Do do do, theme song. Do do do, I'm broke so this is my theme song. Do do do, just imagine this is an awesome theme song. Do do, theme song. Hello, welcome to Left of the Box. Bonjour, bienvenue. I'm Sandy. We here in Canada sure do love to brag about our healthcare. It's a constant point of pride when talking to Americans. It's easy to think what we have here is great when our neighbors put the bar for healthcare in the gutter. If we were to compare ourselves to countries with similar wealth status, we'd find we have nothing to brag about. On top of that, we're losing what we have and not enough people are paying attention. If we don't act now, our healthcare will go in the gutter right along with the states. Please hit the like button and subscribe to my channel if you haven't already. Share this video and get caught up on videos of mine you may have missed. Follow me on Twitter for regular updates, and if you can help out financially, I'd appreciate it. You can become a patron or check out my wish list to help build my studio. Links in the description box below. I feel it's an important reminder that Canada didn't always have universal health care. There are people alive today older than the healthcare systems we're familiar with. Saskatchewan got the ball rolling in 1962 when they introduced a provincial medical insurance plan. Then in 1966, the Medical Care Act was passed by the federal government. 6 years later, all the provinces and territories had universal physician services insurance plans. It was replaced in 1984 by the Canada Health Act, which gave us what we're more familiar with today. I feel it's also an important reminder the cost of healthcare is split between the provincial and federal governments, which is why you can expect a basic level of healthcare no matter where you are in the country, but services differ from province to province. Where you live in the province will also impact the services available to you depending on how remote the area is or what kind of treatments are needed. And I feel it's an important reminder, strike that, since most people were never taught this, it's important information that Indigenous peoples aren't covered by the same healthcare system as Canadians. Canada is an apartheid state, and the details of that deserve its own video, which I will work on making. So, many Canadians think we're one of the top countries for healthcare, only we aren't. In a couple of recent studies I found, which will be linked below, we weren't in the top 10, which doesn't make us horrible, but depending on who we're comparing ourselves to, we rank near the bottom. This from CTV. Canada's health system ranked second last among 11 countries report. Toronto. A new report has ranked Canada's health system second last ahead of the United States among high-income countries. The report released on Wednesday by the Commonwealth Fund ranked 11 high-income countries on key health system measures, including equity, access to care, affordability, healthcare outcomes, and administrative efficiency. The report found the top-performing health systems overall are in Norway, the Netherlands, and Australia, while Switzerland, and Canada, and the US were the countries with the worst healthcare systems, respectively. However, the report noted that the U.S. performance falls far below Switzerland and Canada, despite these countries being ranked directly above it. In addition to its overall ranking, the study notes that the U.S. ranks last on access to care, administrative efficiency, equity, and health care outcomes, but second for preventative care processes such as screening and vaccinations. And if we just go down a bit, the report ranked Canada 10th overall, as well as in two major categories, equity and healthcare outcomes. The report found that income-related disparities in accessing healthcare are the largest in the US, Canada, New Zealand, and Norway. In other words, the more money you have, the better healthcare you get. As with many things the US ranks the worst at, we're often the second worst. So if we only ever compare ourselves to the States, we look to be in good shape. Of the countries with universal health care, we're the only ones that doesn't include pharmacare. Some countries cover areas we don't, like mental health and dental. And from what I could find, we don't rank at the top for any healthcare service. However, the way our politicians carry on about it and how Americans point to us as an ideal example, many are led to believe we have one of the best healthcare systems in the world. As someone who lives with poverty and disabilities and have known many folks in similar situations, I can say without a doubt, our system is not that great, and it's only going to get worse, especially if you live in Ontario.
It appears that the peak of Omicron has passed. That doesn't mean we're entirely in the clear, of course. We still do have high levels in both our hospitalizations and intensive care units. However, that is starting to decline. This week we've had about 3,000 people admitted to hospital. Last week it was over 4,000. We have capacity. That's why we're doing things like releasing Directive 2 somewhat to allow for some of those procedures that people have been waiting for some time to continue. We're opening up pediatric surgeries, cancer screenings, making sure that we can let independent health facilities operate, private hospitals. All of those things are possible because we do have the capacity that the Premier mentioned.
Wait, did you hear that?
Making sure that we can let independent health facilities operate, private hospitals, private hospitals, private hospitals.
This clip was from 3 months ago. The person announcing it is Ontario's Health Minister, Christine Elliott. Interesting how this wasn't a bigger news story in the media. It's almost like the media is owned by the same corporations that own our politicians. Private hospitals have been banned in Ontario since 1973. These hospitals will charge patients for user fees, and patients will have extra bills on top of what OHIP covers. People will no longer have access to the same level of care. How much you can pay will determine how fast you are taken care of and what kind of treatments and services you receive. People with money will jump the queue, making our long wait times even longer. Doug's government is working on giving away more than 18,000 long-term care beds to the same for-profit chain corporations where the rate of death due to COVID far exceeded that of public long-term care homes. People need to remember, when COVID first started, the military had to be called in to help get the situation under control. When they arrived, they found 26 people had died from thirst in long-term care homes. He then passed a law to privatize the last remaining public parts of home care under the cover of the pandemic. He contracted for-profit clinics for COVID testing. He privatized vaccinations. He's working on privatizing the handling of Ontario Disability, ODSP, which means people who need it or people who are on it will be denied as the company looks for more ways to make profit, even at the expense of people's lives. This is only a small part of the damage Doug has already done. While Ontario is the worst for stripping away healthcare, it's not the only province looking for ways to privatize parts of it. From the Halifax Examiner, Nova Scotia healthcare leaders considering more private clinics to tackle surgical waitlists. The health system leadership team appointed by Premier Tim Houston to replace the CEO and entire board of directors of the Nova Scotia Health Authority is looking at every possible option, including increased use of private clinics, to blitz the backlog of 27,000 people waiting for surgeries. That's the highest number of people on waitlists in the past 5 years. Now remember, the reason why these waitlists are so long is due to the cutbacks the governments have already made. Solutions could include sending patients to privately owned surgical clinics outside the province or using public money to pay for more orthopedic procedures at Scotia Surgery, as the government is now doing to reduce the pediatric wait time at IWK Children's Hospital. We have to look at every single possibility to attack the waiting list, Karen Oldfield, CEO of Nova Scotia Health, told the legislators' Public Accounts Committee yesterday. Oldfield replaced Dr. Brendan Carr, who was fired September 1st with a $400,000 severance. Must be nice. It would be irresponsible to not look at every possible scenario to serve people who are in need. And if we go down a little bit more, that explanation did not sit well with NDP Dartmouth North MLA Susan LeBlanc. The response concerns me, said LeBlanc. No one would say we shouldn't be attacking the wait list. There's lots of evidence that expanding private health services only lengthens the public wait times by siphoning the human resources. The resources are finite. I would say now is the time to bolster our public system and not undermine it with private services. The reason our wait lists are so long across the board is due to underfunding and cutbacks of our healthcare. People are having to pay for tests, procedure, and medical devices that used to be covered, all to save a few million here and there. Just a reminder, the Ford government lost $4.4 billion in COVID relief. The spending, waste, and bailouts of corporations that profited could easily fund our healthcare system and make it the best in the world. The deterioration of our healthcare is a conscious decision. It's making people frustrated, pissed off, and desperate for a better system, and that's the point. No politician can stand on the podium and outright say they want to privatize healthcare. Instead, they keep chipping away at it. So when they say, if we privatize this part, it will make things better. And people will believe them. It will happen over and over until our healthcare system is more like the States than what it is to our current system today. What happened in long-term care homes will start happening in other places. The lack of care and services will cost people their lives, but it's worth it to the government if it means more profit. It's because of issues like this I wish my channel to be successful, to reach as many Canadians as possible to get them to take action before it's too late. I don't want people to find out how bad it's gone after they're told to pay for something they can't afford or after they're denied treatments that will make the difference between living with a disability or not. This isn't just the fault of the Conservatives. They wouldn't be able to inflict the damage they're causing if it weren't for the neoliberal policies of the Liberal parties. They're just as much to blame as the Conservatives. I can't stress enough how important it is to vote for it out this upcoming election. If we don't, Ontario will start down a path of privatization with no simple way back. And once Ontario goes, so too will the other provinces. I am going to try my best to get out as many Ford Bite videos as I can in May leading up to the election. My new job at Rebel HQ is going well, but it will take me a bit more before I get into the groove of making videos for them. It currently takes a lot out of me, emotional and time-wise. But in the end, getting my message out there and seeing real change happen, it will be worth it. If we all work together, we can influence how the election will go, most likely being held on June 2nd. My Ford Bite videos will be super short and go over the horrible things he's done. Fortunately, unfortunately, there's a lot to work with. If everybody starts looking for headlines of what he's done since he's been in office and share them on Facebook or Twitter to remind people of how horrible he is, we can do it. We only need to flip a few ridings. I can't change the outcome, but together, we will. Please hit the like button, only hit the subscribe button if you haven't hit it already. Share this video as much as you can. I'm on Twitter way too much. Feel free to join me there. And if you can help out financially, please become a patron or check out my wish list of items for my studio. Every little bit helps, and a special thanks to those of you who already have. Salut, à la prochaine. Thank you for watching and stay tuned. I'm Sandy, wishing your tomorrow is better than your today.